For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
So, today we will discuss about the right atrium. In the previous class, we have already discussed about the external features of the heart, that is the surfaces, borders and also the sulcuses. So, now we will discuss each of these chambers, that is a right atrium, right ventricle, left atrium and also left ventricle. So, first topic is the right atrium. So, right atrium, it is the right upper chamber of the heart. It is a vertically elongated chamber. On the upper side of the chamber, there is a gear-like projection which extends to the left, and it covers the root of aorta and also it partially covers the infundibulum of the right ventricle, and that is called as the auricle. And this auricle, it is spongy in nature and it is notched at its margin, and this spongy nature prevent the leaking of blood. The superior and inferior vena cava, it opens, superior vena cava, it opens on the upper part of the chamber, and inferior vena cava, it opens in the lower end of the chamber. In the right border of the right atrium, there is a shallow groove which extends from the superior vena cava to the inferior vena cava, and this groove is called as the sulcus terminalis, and this groove, it is formed by a muscular ridge, and that is called as the crista terminalis. On the upper part of the sulcus terminalis, there is the SA node, that is the sinoatrial node. It acts as a pacemaker. So, the right atrium, it is separated from the right ventricle from outside by atrioventricular groove, and it lodges the right coronary artery and the small cardiac vein. So, now we will discuss about the inlets or the tributaries of the right atrium. So, superior vena cava, it opens on the upper part, inferior vena cava, it opens on the lower part, and here you can see the coronary sinus, most of the cardiac veins except the vena cordis minimis. These are the small foramens of the vena cordis minimis. These are veins that are present in all the chambers of the heart. So, here you can see the foramens of the vena cordis minimis, and most of the cardiac veins, it opens to the coronary sinus, and here you can see the opening of the coronary sinus. It is guarded by the thespian valve, and you can see the foramens of the anterior cardiac vein and also sometimes the right marginal veins. So now we will discuss about the internal features of the right atrium. So it has got a smooth posterior part and also a rough anterior part. The smooth posterior part, it is called as the sinus venarum. It is derived from the right horn of the sinus venosus. So this is the heart tube. This is the primitive heart tube, and this undergoes several changes and finally it matures to form this heart. So this is seen during the embryonic period. So it has got, this is the sinus venosus, it has got a right horn and the left horn, and this right horn, it is involved in the formation of the posterior smooth part of the right atrium. There are so many openings or the inlets. The superior vena cava, it opens on the upper part, inferior vena cava, it opens on the lowest part, and there is a rudimentary valve of the inferior vena cava. So this is the inferior vena cava, and the inferior vena cava, it is guarded by a rudimentary valve, and that is called as the Eustachian valve. That is the blood from the inferior vena cava, it is guided to the left atrium by the rudimentary valve through the foramen ovale. That is the pure blood, that is oxygenated blood from the umbilical vein. It reaches the right atrium through the inferior vena cava. For that to supply to the whole body, it has to reach the left atrium. So for that, this valve is present. So in between the inferior vena cava and also the atrioventricular orifice, there is the coronary sinus. So this is the coronary sinus. So it is guarded by a valve called as the thespian valve. and most of the veins of the heart, it drains to the coronary sinus, except the vena cordis minimi and also the anterior cardiac veins. So there are also foramens of the vena cordis minimi and also anterior cardiac vein here. And anterior rough part, it is called as the pectinate part, and it is characterized by the transverse muscular ridges called as the musculi pectinati, and in the auricle these muscles, they are interconnected to form a reticular network. And now we will discuss about the interatrial septum, that is the septum that separates the right atrium from the left atrium. In the lower part of the interatrial septum there is a saucer-shaped depression, and that is called as a fossa ovalis, and it denotes the primitive septum primum, that is, this is the upper two chambers of the primitive heart, and this is the septum primum and this is the septum secundum, and during the first cry these two fuses, and this fossa ovalis, it indicates the septum primum, and the margin of the fossa ovalis, and that is called as the limbus ovalis or the annulus ovalis, and this margin, it indicates the septum secundum. So this is the end of today's video. For more videos, please subscribe to my channel.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.